left is Kyle Parker, the chairman of the board of the Fort Smith Regional Healthcare Foundation. My immediate left is Tom Webb, the executive director of the Fort Smith Regional Healthcare Foundation. To his left is Fraser Edwards, the executive director of the Arkansas Osteopathic Medical Association. To his left is Mayor Jared Barling, the mayor of the city of Barling. And to his left is Judge David Hudson, county judge for Sebastian County. Man, I can't believe I did all that. I didn't even look at my notes. Without any further ado, I want to introduce Tom Webb, who is the executive director of the Fort Smith Regional Healthcare Foundation, to begin our presentation.
Thanks, Ivy. What a beautiful day. We are all blessed to be here together to, I think, celebrate something that will be lasting and be special. A little bit about Fort Smith Regional Healthcare Foundation. It was formed on December the 1st, 2009, when Sparks Health System sold its assets. And for the last 4.5 years, we've gone through the process of unwinding that hospital sale and have accumulated a substantial amount of funds. While Fort Smith Regional Healthcare Foundation is not a granting foundation, it has embraced the mission of the Deegan Foundation. The Deegan Foundation, which serves our community by granting and gifting scholarships to those in our area. And I would like to share that mission with you, because I think for you to understand what we're doing, you need to understand that we're a mission-driven organization. Providing for our region's healthcare needs by investing in practical solutions today with a vision for tomorrow. I think you will find that we are trying to build that vision. I think you will recognize that our board preaches that, and that the vision that creates will create the outcome that we want. At this time, I'd like to introduce our board of trustees and others. Jeff Beecham, Mike Rappaport, John Taylor, Jim Patrick, Dr. Penny Good, Bonnie Hawkins, Judy Borum. And David Craig is on the board of the Deegan Foundation, and he's joined us too. I think, from my standpoint, we owe them a big round of applause. And the people that try to keep you straight, they don't do a very good job, but they try to keep you straight, are our staff. There are 3 of us. Dennis Bauer is our CFO, right back there, and then Rebecca Amos is our office manager. And I'd like to recognize them for all their support and hard work as we worked our way to this point. Thank you all. It's now my pleasure to introduce to you Kyle Parker. He is our chairman. There were 7 out there, there's 1 up here. He's the one that's going to deliver the news.
Thank you, Tom. Over 2 years ago, one of our former Board of Trustees members, Mr. Jim Walcott, he challenged the board with what he described as move the needle towards our mission to fill gaps in healthcare and provide care for the medically underserved regions in Arkansas and the state of Oklahoma. We've since been working towards that goal. For more than a year now, we have studied the feasibility of establishing an osteopathic medical school in the region. This involved the study of medically underserved areas in Arkansas and Oklahoma. What we discovered was that while Arkansas and Oklahoma are right at the bottom of physician accessibility in the United States, we're respectively 48th and 49th. What we also clearly identified that both the western Arkansas and eastern Oklahoma regions are the most underserved areas. In addition to looking at the feasibility, we studied funding, recruitment, education and community interest and the involvement thereof. The response that we received from the community to establish a proposed osteopathic school was overwhelmingly favorable. Am I supposed to push this button over here, or?
I got you. I got you.
You got me? Good job. Today, I'm very proud to announce the unanimous decision of the Board of Trustees of the Fort Smith Regional Healthcare Foundation to move forward with the establishment of the proposed osteopathic medical school. To that end, the board has committed funds in excess of $58 million. The board further authorized the hiring of a president and CEO and authorized the hiring of a chief academic officer. The foundation has also received a generous gift of property from the Fort Chaffee Redevelopment Authority to locate the school and allow for future expansion of additional healthcare needs. On behalf of the Board of Trustees of the foundation, I want to personally thank Ivy Owen and the Board of the Redevelopment Authority for this wonderful gift. Thank you. In addition to recruiting the CEO and the CAO, one of the key requirements in the development of any medical school is the clinical rotations and the subsequent residencies of its students. With assistance from the Arkansas Osteopathic Medical Association, the foundation has developed a number of partnerships to answer this requirement. I would like to thank personally Dr. Cole Goodman, President, Mercy Clinic, Mr. Charles Stewart, CEO, Sparks Hospital, Mr. Doug Babb, CEO, Cooper Clinic, Dr. Jason Hill, Chief Medical Officer of the Choctaw Nation Health Services Authority, and Ms. Sip Moulton, the CEO of Community Health Centers of Arkansas, for their help in establishing all of the clinical rotations and subsequent residencies of these graduate students. They're here in the audience today, and I thank you profusely for your commitment to this community. Thank you. This group of fine individuals with their respective entities, along with our Associate Dean of Clinicals from the school, undertake this very important component. In addition to this immediate region, further partnerships with medically underserved areas throughout Arkansas and Oklahoma are also in development at this time. While the foundation understands that the establishment of this school and eventual additional health-related coverages and related colleges that we create will add millions and millions of dollars of economic impact to the community and to this region. To our foundation, it's not about building a school. It's about recognizing needs and using our resources to fulfill them. And now let me let you look at the first peek of our initial master plan for the campus. We'll go ahead and blow this up a little bit, if I can. Here's your medical school being built coming off of Chad Colley Boulevard. Here, you can see the campus green with the subsequent schools that we already have thoughts on that I can't announce at this time. As you can see, this sits on 200 acres of property. The economic impact, as we know it to be right now, is somewhere between $75 and $100 a year, just for the, I'm sorry, $100 million. These numbers get really high. Everybody needs a good joke now. Again, we know what this is going to do to this medical school. We realize that, but I can promise you this. It would never happen without this community's involvement. And we as this foundation understand that. We are humbled by that. Yes, we're putting up $58 million, but it's to fulfill needs on the things that we know will provide a difference in people's lives. So for that, I thank you. And I would like Fraser Edwards, if that's okay. He is the Executive Director of the Arkansas Osteopathic Medical Association, who's driven down from Little Rock to say a couple of words to us. Thank you.
Thank you, Mr. Parker, and thank you to everyone sitting up here today. We wouldn't be here without you, and the AOMA wants to thank you for your support again. At this time, I would like to introduce the DOs with us here today. Dr. James Zini, AOMA past president of the AOA. Dr. Sider, who is an AOMA Board of Trustees. Dr. Sanders, a past AOMA president. Dr. Gary Edwards, a past AOMA president. And Dr. Baker, who will be here shortly, who is the current AOMA president. We stand on the shoulders of these giants, and we thank them for all that they've done over the past 30 years to get to where we are today. So thank you very much. With that, I just want to reiterate that the AOMA is extremely excited about the development of this proposed Arkansas College of Osteopathic Medicine to be located here at Chaffee Crossing and in Fort Smith, Arkansas. We will continue to develop, to funnel resources, and to support those who are willing to provide statewide resources for this proposed College of Osteopathic Medicine. And I'm very grateful for the Fort Smith Regional Healthcare Foundation that they came along, because their mission, like ours, and like so many of yours that sit in this room today, their mission completely aligns with ours to produce quality primary care physicians in rural areas of need. And we look forward to advancing healthcare throughout the state and in Fort Smith and on the western side of the state. With that, I would like to turn it over to Ivy Owen, because his support has been great throughout this entire process. And thank you, Ivy, again.
No, I don't know how much more to say. I don't know how much more excited I can get than I am now. This has been a fairly long process in terms of economic development. We've been working on this off and on, but mostly on for about 2 years, and it's come to fruition. And when I woke up this morning and went in the bathroom and started shaving, I said, my God, thank you for this. This is big. The Fort Chaffee Redevelopment Authority Board of Directors at 3:30 this afternoon unanimously voted to donate 200 acres in Barling and Fort Smith to the foundation for the development of this proposed medical school. That in itself defines the commitment that we have as the authority and the foundation has as the funding agency to build this medical school. I can tell you very quickly that our board, who's sitting over here in this third row, does not give away 200 acres on the fly. Their due diligence is beyond reproach, and when we made that decision to do this, we were very convinced this was a great thing to do. We're happy to be a partner with the Fort Smith Regional Healthcare Foundation with the integrity and the history they have in this community. I'm tickled to death to have the support of the Mercy organization, the Sparks organization, and the Fort Smith Regional, what is it? Healthcare. Well, I know that, but the Community Health Center.
Oh, Include the clinic and the Choctaw Nation.
Yeah. And Cooper Clinic and the Choctaw Nation. With those partners in place, there's just about no way to go wrong with this endeavor. The land situated in both Barling and Fort Smith, which is great. There's 87 acres on one side and 113 acres on the other side. We tried to get it split even, but we couldn't figure out how to do it. The development's going to be great for both cities. We're looking for a great partnership with the city of Fort Smith, as they always have proven, and the city of Barling too, in pursuing this and making this become a reality. The Fort Smith City Board of Directors are here in the fourth row. The Barling City Board of Directors are here in the support of this. It is in truly, truly an example of a regional effort to bring health care to the underserved. And it's truly an economic development project. The economic impact of this is immeasurable. We tried to figure out a way to measure it. Kyle said $75 to $100 million. That's just the initial impact. When you start looking at the families that are going to be impacted with this, the jobs that are going to be created, it goes a lot further than that. It'll also attract commercial, retail, and further residential development to the area. So I don't see a downside. This is a great, great day. And with that, I'll turn it back over. And by the way, thank everybody. There's no way we can recognize everybody that had a hand in this. I can recognize our staff, who always in the back of the room, except you. Without them coming in on their days off and working on this, we wouldn't be here today. So I appreciate it. Tom, I'll turn it back over to you.
Thank you, Ivy. Thank y'all for the gift. Kind of cool. Jerry, would you like to say something? Jerry Barling, Mayor Barling.
Let me just say on behalf of our community and our board of directors that we always support this endeavor. Kyle, I know the money's kind of money and me and a lot of money. But anyway, we do appreciate y'all endeavor to come to our community and we hope to work well in the future. And this is going to be a great thing for everybody. Thank you.
To speak next is the mayor of Fort Smith, Arkansas, Sandy Sanders.
Thank you, Todd. Well, this has been a long time coming. But the announcement today of the proposed Osteopathic College of Medicine in Fort Smith and Barling is wonderful news. This is a game changer for this entire region. Not only will it provide a needed influx of physicians to improve critical health care in this region, it will also provide a significant boost to our regional economy, $75 to $100 million. Now, there's a few things that Kyle has mentioned before that I want to add that he didn't include today. Each year, 150 students will be admitted to this college. 600 students over their 4 years that they'll be here. 65 terminal degree faculty, doctors, PhDs, top-end individuals who will be faculty members. They will make better than $100,000 a year salary. And then you add all the ancillary folks who will be supporting that. You can see readily the types of impact. You know, these are not made up numbers. These are real things. The first class is anticipated to enroll and be out here going to class in the fall of 2017. So there's a lot of work that needs to be done between now and then. But with these folks, it will happen. So on behalf of the City of Fort Smith, our Board of Directors, our administration, I extend our thanks to the Fort Smith Regional Healthcare Foundation for its leadership and substantial investment in the health and economic well-being of Western Arkansas and Eastern Oklahoma. Thanks also to the FCRA, the Arkansas Osteopathic Medical Association, Fort Smith Chamber, University of Arkansas, Fort Smith, the cities of Fort Smith and Barling, and all people who have worked with the Fort Smith Regional Healthcare Foundation on this effort. Well, as the last speaker, Tom told me to be the last speaker, so I guess I'll wrap up. But I want to thank you for coming. I want to thank you for being here as part of this significant announcement for Western Arkansas and Eastern Oklahoma. And I invite you to continue